Alright, so good day everyone. So for day class, let us discuss what we, let us rationalize the questions we had during our pre-board exams in pharmacology. So let's start off class with the autonomic nervous system. So first question was, excuse me, myasthenia gravis. What is being targeted by the immune system causing muscle weakness? So the correct answer, of course, class would be the cholinergic receptors. Alright? Now, majority of you answered neuromuscular junction. Now, you have to remember, class, that the neuromuscular junction, if this is the pre-synapse and here's the post-synapse, okay, this area here, class, this gap between the synapses is called the neuromuscular junction. Okay, that's the junction here. Alright? So, kumbaga, it's technically a gap. Okay, what's being targeted, class, by the immune system would, of course, be the receptors directly. Okay, it would be the receptors. The receptors within the neuromuscular junction. Okay, so to be more precise, class, okay, the target of the immune system, in the case of myasthenia gravis, would be the cholinergic receptors, not necessarily the neuromuscular junction. It's the cholinergic receptors found within the neuromuscular junction. Okay? All right. So next question. Which of the following enzymes metabolize catecholamines? So very good. That would be COMT. The other enzyme that would be metabolizing catecholamines would be the MAO, or what we call the monoamine oxidase enzymes. Okay, hydrolases, obviously, this one causes hydrolytic reactions. Proteases, naman, on the other hand, destroys proteins or metabolizes proteins, and then esterases breaks down esters. Next question. This drug is useful for narcolepsy. So very good, class. The correct answer for that would be amphetamine. Not epinephrine, class, ha? Epinephrine is considered to be adrenaline. Usually ginagamit it, this is usually used for allergic reactions, okay, or to increase the pumping capacity of the heart, or when the patient has call this cardiac arrest. So we can use epinephrine for that. Now, amphetamine, on the other hand, class, specifically methylphenidate, say for example, which is also used for ADHD, is basically used for narcolepsy, a condition wherein patients spontaneously sleeps. Okay? All right. Next question. Which of the following direct sympathomimetics has a short duration of action? So, correct, class, the correct answer here would be isoproterenol. If you remember, class, our direct sympathomimetic short-acting drugs, okay, di ba, we have the mnemonics denied. Okay, dopamine, epinephrine, norepinephrine, isoproterenol, and then dobutamine. Okay, then the rest, class, terbutaline, metaproterenol, and phenylephrine, these are drugs, class, that are long-acting. That's why they can be given in their solid dosage form. Okay? Okay. Excuse me. Next question. This drug is marketed as a nasal decongestant. So very good. Everybody knows this. It's phenylephrine. This is the prototype drug for beta blockers. Very good. The first beta blocker ever to be made was propranolol. Then direct sympathomimetic drug. This direct sympathomimetic drug is a tocolytic agent. So there are two answers for this one, class. Okay, terbutaline and ritodrine, both of which are beta-2 agonist. All right? So in the Philippines, class, normally we use terbutaline. We normally use terbutaline. Ritodrine, in other countries, they have this. I haven't seen this yet in the Philippine market. Okay, but both of which, class, are beta-2 agonist. And as you all know, beta-2 agonists are considered to be tocolytic. When we say tocolytic, class, it prevents premature labors. Okay, next question. Which of the following drugs release neurotransmitters from the presynapse instead of binding directly to its receptor? So we're looking for a drug, class, that is an indirect acting sympathomimetic drug. So epinephrine, also known as adrenaline, okay, and then isoproterenol, class, part of the denied. Diba sabi na, these are the direct acting. So meaning they bind directly to their respective receptors. So the only drug here, class, that is an indirect acting, okay, would be methamphetamine, or also known as your amphetamine, a derivative of your amphetamine. Okay, where in class they act simply by increasing norepi release, decrease MAO activity, MAO and COMT activity, and then of course class they also decrease reuptake of catecholamines. Okay, so that's the MOA of our amphetamine or any of its derivatives, making them an indirect acting sympathomimetic drug. Right, next one. Pheochromocytoma is often treated with, well, there are two options, class. You can either use phenoxybenzamine or phentolamine. Now, phenoxybenzamine, class, which is the correct answer for this one, is usually used prior to surgery. Okay, so kumbaga, if you want to have the tumor in your adrenal glands removed, then we usually use phenoxybenzamine class as a medication prior to surgery. Now, if you're managing the paroxysmal hypertension associated with pheochromocytoma, yes, if you can remember, class, there's in pheochromocytoma, there's a tumor on top of your adrenal glands causing the excessive production of adrenaline, okay, which of course elevates the blood pressure and causes so many complications. So if you just want to manage, class, the hypertension associated with that condition, with pheochromocytoma, then we use phentolamine. Okay? Metoprolol, class, I don't think it's gonna be that effective for pheochromocytoma. Next question. This organophosphate is used for glaucoma. So very good. That's ecothiopate. Okay. The keyword here, class, is organophosphate used for glaucoma. Parathion is an organophosphate, but it's mainly used as an insecticide. Carbachol is a cholinergic agonist. Physostigmine is a cholinesterase inhibitor. Okay, so ecothiopate lang ang matitirang correct answer dito. Next question. A male was found to have an enlarged prostate gland and is currently having difficulties in urinating. Which of the following would help with his condition? So, very good. Any drug class that's an alpha-1 blocker. Diba sabi natin, ang palatandaan for alpha-1 blockers would be any drug that ends in zosines. Okay, so prazosin class would be a good choice if a patient is suffering from BPH or benign prostatic hypertrophy. DOC for BPH or benign prostatic hypertrophy. Lumalaki yung prostate gland. Right. Next question. Marami-rami ang nagkamali. So all the following drugs are rarely used due to its hypotensive effects except, okay, remember, class, guanadrel, resorpine, beryllium. Most of these drugs, class, are used as antiarrhythmic drugs and they are considered to be last choice. Okay, last resort sila. Because, class, of their hypotensive effect. Okay? Because of their severe hypotensive effect. Unlike that of clonidine, class, yes, it does reduce the blood pressure, pero just enough, class, to be considered safe. Okay? And, class, remember, clonidine is mainly used for hypertension. Okay? Kaya sorry, that's the reason why, class, clonidine is the correct answer here. These drugs, class, these guanadrel, resorpine, beryllium, these are presynaptic antiadrenergics. And if you can remember during our discussion, class, these kinds of drugs are no longer used. They may be used, class, pero as last resort because of their hypotensive effects. And it's very dangerous. Next question. So patient GH was diagnosed to have a tumor in his adrenal glands and is causing excessive release of norepinephrine. Obviously, meron siyang pheochromocytoma. So the patient has pheochromocytoma in this case. So which of the following would be used to manage his paroxysmal hypertension? So as I mentioned a while ago, to manage paroxysmal hypertension, class, then we will be using phentolamine. Phenoxybenzamine, again, class, is mainly used for as a pre-surgery medication for pheochromocytoma. Okay, pero again, class, that kind of disorder is kind of rare. Okay, haven't seen anyone diagnosed with that condition yet here in the Philippines. Next one, patient LD is 3 months pregnant and is having labor. Which of the following should be done? So very good. The correct answer, class, would be to give terbutaline. Why? Okay, because the patient is only 3 months pregnant. Obviously, class, if you're already having labor at 3 months, baby is still premature. Okay, probably the baby is still a fetus. Okay, so that's something that's dangerous. It could cause spontaneous abortion. So to stop class the labor, you have to give a beta-2 agonist. So in this case, class, we give terbutaline. Okay, isoproterenol, class, rarely used. I've never seen it being used for pregnant women. Normally, we give this for asthmatic patients. The reason why, class, is isoproterenol kasi also binds to beta-1 receptors. It can be used, sure. Okay, pero kasi we have a better option here, okay, which is terbutaline. Okay. Next question. Patient RC was rushed to the hospital due to sudden difficulty in breathing. Upon interview of her companions, it was found out that she ate shrimps, which she was allergic to. So the keyword here, class, is patient was allergic. Okay. While patient RC was in the hospital, her BP suddenly dropped very low. What medication should be administered to her immediately? So very good. If a patient, class, is experiencing anaphylactic reactions, such as sudden drop in BP, difficulty in breathing, then, class, the drug of choice for that would be, of course, epinephrine. Now, say for example, class, in this scenario, it wasn't stated that the patient is experiencing an allergic type of reaction. And just the patient was just brought to the hospital with severely or with a very low blood pressure. Now, class, if the reason for the low blood pressure is unknown, okay, then a good drug class would be norepinephrine, because this one is mainly used for life-threatening hypotensive events. Alright, that would be a good option. Pero in this case kasi, we already know that the patient is experiencing an anaphylactic reaction, because it was stated that the patient ate shrimps, which she was allergic to. Okay, so therefore, class, a better option would be, since we know the cause, we can give a more appropriate drug of choice, which is adrenaline. Pero sure, pwede naman norepinephrine if we don't know what caused the sudden drop in blood pressure, because this is very life-threatening na. Pero again, the correct answer for this specific scenario, class, is adrenaline, because we've already mentioned that she's allergic to shrimps. Or she's having an allergic reaction, sorry. An anaphylactic reaction, to be more precise. Next one. Which of the following beta-1 blockers is most selective? So very good. That's nebivolol. Amongst the beta-1 blockers class, nebivolol is the most beta-1 selective. The rest kasi, like bisoprolol, esmolol, atenolol, have the capacity to bind to beta-2 receptors as well. Right? Next question. Which of the following medications can displace norepinephrine from presynaptic terminals? Okay. And bind to adrenergic receptors. So, class, what we're looking for here is an indirect acting sympathomimetic drug. Okay, an indirect acting. So, okay. So, which of the following medication can displace? Yeah. So, we're looking for the indirect acting one here, class. Now, actually, there are two correct answers for this one. We can have ephedrine, and then we can have actually amphetamine as well. Okay? The only thing is, so majority of you guys answered ephedrine, so which is correct. Adrenaline, class, is not a correct answer because it's a direct acting sympathomimetic drug. Okay? Ayan. And no one answered amphetamine here. Next question. Which of the following side effects is similar between clonidine, prazosin, and phentolamine? Alright, so very good. It causes orthostatic hypotension. Orthostatic hypotension, class, is what you experience when you suddenly rise up, okay, then suddenly feel dizzy. Okay, that's the drop in blood pressure due to a change in your position. Okay, and that's very common, class, for drugs that cause vasodilation, such as clonidine, which is an alpha 2 agonist, prazosin, which is a alpha 1 blocker, then phentolamine, which is a non-selective alpha receptor blocker. Okay. Rebound hypertension, class, is specific for alpha 2, for clonidine. Okay. Then reflex tachycardia is a common side effect for prazosin. Alright. And also, of course, phentolamine din. Anyway, Next one, beta blockers can reduce blood pressure by causing all of the following except. Okay, so very good. They don't cause vasodilation. Okay, they mainly target class D. What do you call this? They mainly target the heart. Okay, and of course the kidneys to reduce renin secretion. So what causes vasodilation kasi class would usually be a beta-2 agonist. Right? And beta blockers don't do that. Next question. A patient with acute heart failure would mostly be managed with which of the following drugs? Okay, so very good. There are two drugs class we can use for heart failure. Okay? We have, wait lang, let's just erase all of this. Okay? So, the other drug class is dobutamine, which is an inotropic drug. And then we have dopamine, which is a vasopressor. Okay, or which causes vasoconstriction. Ito naman, inotropic increases heart force of heart contraction. Okay, which is both ideal class for patients with heart failure. Heart failure kasi humihina na yung tibok ng puso ng patient. Obviously, you'll be giving dobutamine. Next question, which of the following would be used as a pre-anesthetic medication? So, correct class. There are two drugs that can be used here. Tubocurarine, which is a, what do you call this? It induces paralysis. Then atropine class can also be given for the reason class that atropine can be used to decrease secretions. Okay, by reducing secretions class, mas madaling mag-insert ng mga tubo, hindi siya nababarahan. Okay? Tubo sa throat. Okay, say for example, to allow the patient to breathe, lalagay ka ng respirator and so on and so forth. So either of the two class can be used. Tubocurarine, again, can be used as a paralyzing agent. Mecamilamine, no. Rarely, never naman ginamit to as a pre-anesthetic medication. Next question, which of the following is a depolarizing ganglionic blocker? Okay, so very good. We have here class nicotine as a depolarizing ganglionic blocker. Next one, meperidine is a muscarinic antagonist mostly used for what condition? So very good. Everybody knows this. Excuse me. Parkinson's disease. I think the Akiniton nga ba? Anyway, ang kanyang brand name I forgot. Next one, cholinergic agonists are often used to manage glaucoma due to their capacity to contract which eye muscle, causing a decrease in IOP or intraocular pressure. So very good. It mainly targets the ciliary muscles, causing constriction. Okay, radial muscles on the other hand class are often targeted by adrenergic agonists. GI ulcers can be managed by which of the following drugs to reduce secretions of hydrochloric acid? So very good. We have here the drug pirenzepine, okay, which targets mostly muscarinic receptors, which prevents the production of hydrochloric acid. Okay, benztropine on the other hand class, usually ginagamit to for Parkinson's disease. Okay. Overuse of cholinergic agonists can cause all of the following except, okay, take note of this term, cholinergic agonist. So class constipation is a classical sign of a cholinergic antagonist. Ibig sabihin, pag cholinergic antagonist, it's the opposite. It always produces the effects that are opposite of the dumbbells. Diba? D here is diarrhea. So opposite of that would be constipation. Okay? Use urination, meiosis. The nausea would be more of its effects on the CNS. Okay? Which of the following drugs should be avoided for people with glaucoma? So very good class. The correct answer here would be homotropin. Okay? Normally class, when you have glaucoma, you always try to avoid a cholinergic antagonist. Kasi nga class, when you give cholinergic antagonist, it increases IOP. Okay? Which is something you don't want to happen class if a patient has glaucoma. Neostigmine, pilocarpine, carbachol, these are all cholinergic cholinergic agonists. Okay? which can be used for patients with glaucoma. Okay? Then homotropin class, it's a cholinergic antagonist. Which of the following drugs manages asthma? So very good. Majority of you answered this one correctly. It's ipratropium. Often combined with salbutamol. Combivent ang labas. Which of the following conditions would merit the use of a cholinergic agonist? Obviously, class, you won't give cholinergic agonist to people with diarrhea, bradycardia, and enuresis because this will exacerbate the condition. Okay? Normally, class, a cholinergic agonist would be ideally used for patients with xerostomia or what we call dry mouth. Xerostomia. Okay? So, kasi by giving a cholinergic agonist, okay, ACH agonist, it can increase secretions. Specifically, saliva. Right? To help manage xerostomia. So this organophosphate was once used in the chemical warfare and was also used during a terrorist attack in Japan, causing death of multiple people inside the train tunnel. So that's correct. It's the sarin gas. Okay. So let's proceed, class, to the next one, which is hypertension. Right, so this drug reduces blood pressure by acting on vasomotor centers in the CNS. So very good. The correct answer for that would be clonidine. Okay, it's an alpha-2 agonist class and it's considered to be a centrally acting, okay, antiadrenergic. Okay, so these are the alpha-2 agonists, such as clonidine, methyl-dopa. Okay, enalapril is a ACE inhibitor. The targets usually the angiotensin-converting enzyme produced by the lungs. So when a patient has hypertension without comorbidities, which drug will be the first choice? So very good, it's indapamide. Okay, why indapamide, class? No comorbidities, ha? Indapamide is considered to be a thiazide diuretic. Eh, di ba sabi sa atin sa guidelines, okay, based on the okay, based on our GNC guidelines, for hypertension, drug of choice would be, or the starting drug, ideally, would be a thiazide diuretic. Losartan, class, usually binibigay ito kung may diabetes ang patient. Although pwede rin naman bigay sa mga hypertensive patients. No problem naman doon. Pero again, ideally, class, we start with thiazide diuretic. Now, if the patient finds the enuresis, the urination class bothersome, then yes, we can start with losartan. Pero between the two, thiazide diuretics have better data supporting the claim na mas maganda siya as an initial treatment. Based on current researches, which of the following drugs have been shown to produce higher incidence of cardiovascular events, such as increase in lipid levels or significant decrease in blood pressure? So very good. Beta blockers, class, are said to cause an increase in lipid levels. So hence, metoprolol would be the correct answer here. Okay, madali na to. This drug blocks alpha-1 adrenergic receptors. Any drug that ends in zosines. So we have prazosin. This drug is an inhibitor of renin synthesis. Okay? Now, normally, class, we have, for renin, kung renin synthesis inhibitor talaga, we have the drug aliskiren. Okay? Which reduces renin. Now, obviously, sa options natin, walang aliskiren. So, bakit si propranolol? Si propranolol, class, is a, you have to remember, this is a beta-1 and beta-2 and that's antagonist. Okay, beta-1, beta-2 antagonist. Now remember, class, you need beta-1 activation to increase renin. So by blocking beta-1, you actually reduce renin synthesis. Hence, class, this is the more appropriate answer. Losartan, class, doesn't inhibit renin. Okay, it inhibits the binding of angiotensin 2 angiotensin 2 to its receptors, but it doesn't inhibit renin synthesis. Next one, this drug is a non-peptide angiotensin 2 receptor antagonist. Normally, class, ang mga angiotensin 2 blockers natin ends in sartan. Sartan, valsartan, telmisartan, and so on and so forth. Pero the one drug class that is an ARB, angiotensin 2 receptor blocker, that does not end in sartan is saralacine. Okay, captopril class is an ACE inhibitor. It's not an ARB or an ARB. This drug is contraindicated in patients with bronchial asthma. So very good, propranolol, because of its ability to block beta-2 receptors causing asthmatic attacks or bronchoconstriction to be more precise. Next one, which of the following drugs would cause persistent dry coughing? Okay, di ba? A classical sign class or a classical side effect of ACE inhibitors, which is, as option natin would be enalapril. Now, what causes nga ba class the coughing, the persistent dry cough for ACE inhibitors? Now, remember class that ACE inhibitors like enalapril, they obviously class inhibit angiotensin converting enzyme, ACE. Normally, class, you need ACE to convert renin, or to allow renin to be converted into, sorry. You need ACE to convert angiotensin 1. Okay, stroke eraser tayo. Oops. Okay. To angiotensin 2. Okay? Now, pag naging angiotensin 2 na siya, di ba dito lumalabas, this is where we get increase in BP, increased heart rate, etc. Okay? Now, the thing class with ACE kasi is, it's also the same enzyme that converts bradykinins into its inactive form. Okay? The thing with bradykinins class, these are inflammatory mediators. And they can cause class irritation to the lungs. Now, by inhibiting angiotensin-converting enzyme, okay, so at least naiwasan natin ang formation, we prevented the formation of angiotensin 2. And at the same time, class, we increase bradykinin levels. So by increasing bradykinin levels, class, this is going to manifest as persistent coughing. Okay? It's going to cause persistent coughing. Excuse me. All right. So are we good? Okay. So let's proceed to the next one. This diuretic. Okay, so this diuretic is often used to manage people with chronic calcium stone formation. So very good. Everybody knows this. It's hydrochlorothiazide. Because class, it can spare calcium. So tendency is calcium stays in the blood and not in the kidneys. Okay, so as long as calcium is not in the kidneys, class, then we prevent calcium stones from growing any further. Okay? Okay. Next one. The reason of beta blocker administration for hypertension treatment is very good. It's the main thing why we're using beta blockers class is to decrease the workload of the heart. So by reducing the workload of the heart class, we reduce blood pressure. Right. Next one. Congestive heart failure. So which drug is often used to manage all types of CHF? So is it diuretics, ACE inhibitors, nitrovasodilators, or digoxin? Okay, all types of CHF. So class, the correct answer here would be, of course, diuretics and ACE-ICE. Nitrovasodilators class are often used during the latter stages of CHF. Same goes with digoxin. So 3 and 4 class is used for latter stages of CHF. Usually during the first stages 1 and 2, we can use beta blockers to prevent cardiomegaly from happening. Pero all throughout class CHF treatment, you will always be using a diuretic and an ACE inhibitor. Okay? Which drug can improve left ventricular ejection fraction? So very good. That's an ACE inhibitor. That's why class it's often used throughout CHF treatment. Okay, between captopril and losartan class or an ARB, for CHF class, ACE inhibitors would be a more a better option, kumbaga. Pero when it comes to hypertension, ARBs are the better choice. Which drug is the first-line drug used for CHF with atrial fibrillation? So very good, that's digoxin. Because aside class from increasing the force of pumping of the heart, digoxin also helps manage atrial fibrillation by slowing down SA node firing. Okay, which is a problem when you have atrial fibrillation. Next question. Which beta blocker is often used in managing CHF? Okay, so very good class. We have here metoprolol. Metoprolol and esmolol class are the drug of choice for CHF, managing CHF. So these are the two beta-1 blockers that are well known to be a good option for CHF. Next one. Which diuretic is combined with beta blockers? Which diuretic is combined with beta blockers plus ACE for improved survival for patients with systolic heart failure? So very good. The correct answer for that would be spironolactone. Why, class? Because spironolactone class is said to increase or it's said to improve further, okay, the effects class of the combination of beta blocker and ACE inhibitor. So generally, in terms of survivability, evidence have shown that the combination of these three medications would be good. Okay. ACE inhibitors presents the following side effects except, okay, persistent coughing, angioedema, fetal toxicity, or hypokalemia. So the correct answer, class, would be hypokalemia. Why? Because ACE inhibitors causes hyperkalemia. Excuse me. It causes hyperkalemia. Next one. Which diuretic is only effective for mild cases of CHF? So class, please take note, furosemide class is used from stage 1 to stage 4 of CHF. Okay, so all throughout class, gamit na gamit si furosemide, not only for mild cases. It's hydrochlorothiazide class, which is only used for mild cases. Because between the two, furosemide and HCTZ, furosemide class is more potent. Okay, it's very potent. It's a very potent diuretic drug. Okay? Hydrochlorothiazide is just a mild diuretic. Kaya madalas siyang, that's why it's often used for hypertension. But it can also be used for CHF, pero during the mild stages of CHF lang. Next one. Which of the following drugs used in CHF has antiarrhythmic properties? So very good, beta blockers, right? Well, the other drug would be, of course, digoxin. Okay, pero another drug class would be beta blocker. If you remember, class, beta blockers are classified under class 2 antiarrhythmic drugs. The rest don't have antiarrhythmic properties. Antidote for digoxin toxicity available in the Philippines, very good. We have KCL. This is the one that's mainly used for digoxin intoxication here in the Philippines. Antidote, of course, class, would be digibind. Okay? Pero the thing is, we don't have digibind in the Philippines because it's a antibody that should be prepared fresh. And we don't have yet, class, the mechanisms or the tools, okay, or the apparatuses to make antibodies here in the Philippines. I mean, to make them in the hospital setting. Okay, so the next best thing, of course, would be to give KCL na lang, potassium chloride. Next one. What drug is an alternative for spironolactone if a patient experiences gynecomastia? So very good. Eplerenone is the option here. Okay, next one. Let's go to angina na. Which drug is a long-acting vasodilator? So very good. That's isosorbide dinitrate. Nitroglycerin class is short-acting. Okay? So for short-acting class, we have nitroglycerin. Okay? Sinama ko na lang si amyl nitrite because it's technically a short-acting. To be more precise class, it's a ultra short-acting vasodilator. Okay? Pero sige, pwede na rin natin consider yan as short-acting vasodilator. Which nitrate is given by inhalational route? So there's only one drug for that. That's amyl nitrite. Which of the following can be used to minimize bleeding during surgery? So very good. Amongst all of the options here, class, we have sodium nitroprusside because it's given as IV infusions during surgery to minimize bleeding. If you can remember, class, during our discussion, you don't want the blood pressure of a patient undergoing surgery to be high because it's going to cause your patient to bleed out. Right? So you want to manage blood pressure. Normally, class, or nowadays, we use the cardipine drip. Pero wala siya sa option natin, so it's not part of the option. So the next best thing would be to use sodium nitroprusside. Monday's disease is due to what substance? Everybody knows this, it's nitrates. Dipyridamole is a, very good, it's a non-nitrate vasodilator. Not only that, dipyridamole can also be a antiplatelet drug. Okay, it can also be used as antiplatelet. For its vasoselective effects, which calcium channel blocker would be used? So there are two options here we can use, either nifedipine or amlodipine. So both drugs class are classified under second generation CCBs. Second gen CCBs, which all ends in dipines, or we call the dihydropyridines. And these are vasoselective, meaning they cause vasodilation. Okay. Which of the following side effect is common to most vasodilators, especially arteriolar? Very good. Reflex tachycardia class, which is a compensatory mechanism to the sudden drop in blood pressure. Which of the following patients, for patients who had recent MI, which drug should they avoid managing their angina? Very good, nifedipine, because it's going to cause reflex tachycardia. Okay? And of course, if you get reflex tachycardia class, it's going to make your MI worse. All right. So to prevent reflex tachycardia from nitrates, which of the following drug is used or added? It's usually added. So very good, we often add class a beta blocker. Why? Because beta blockers class can reduce heart rate and prevent reflex tachycardia. Okay, because beta blockers reduces heart rate. Okay, now let's proceed class to anticoagulants. Actually, antiplatelets, anticoagulants. Patient has been diagnosed with atrial fib and will be using a medication at home for it. Which of the following medications would be ideal for the patient? Now, oftentimes, class, if you already have atrial fib, you are at a high risk. High risk na to for blood clots. And when you are already at a high risk for blood clots class, oftentimes, you'll be given an anticoagulant. Okay, low risk, then you'll be given class antiplatelets. Okay, so obviously class, since it's atrial fib, I'll be using anticoagulants. I only have two options here, warfarin or heparin. Clopidogrel class is an antiplatelet drug. Okay, normally class, if you're going to use clopidogrel for atrial fib, you have to add another antiplatelet such as aspirin, the combination of the two drugs. Okay, but here class, we're only asking for one drug. Okay, so I'm only down to two options, warfarin or heparin. Heparin class obviously cannot be used at home because you have to give it intravenously. So hence, the only option I have here would be warfarin, which is available in its tablet form. Next question, why is aspirin the preferred drug to prevent the onset of first stroke? So there's only one reason, class. It's because it's cost effective. Patient AY was receiving enoxaparin for her deep vein thrombosis. When CBC was ordered, it showed that her platelets went down significantly. What must be done? So very good. Change enoxaparin, which is a heparinoid, low molecular weight heparin, to argatroban, which is the drug of choice class if a patient is experiencing thrombocytopenia, okay, which is a decrease in platelets, all right, upon use of heparins, right? Yeah, so argatroban. Argatroban, DOC for heparin-induced thrombocytopenia, which is a decrease in platelets. Next question. Patient BG is complaining of pain and numbness on her legs. Upon referral to the physician, it was found out that there are small blood clots along the veins of her legs. She has no cardiovascular problem. What medication would be the best? Think of the term, huh? Would be the best for the patient. Now, class, all of these medications can be used for the patient. This is what we call class her condition, okay, patient's BG condition class, wherein there is pain and numbness on the legs and there's small blood clots. We call this peripheral claudication. Peripheral claudication, which is a condition class wherein there are small blood clots in the legs. Now, normally class, if a patient is experiencing claudication, DOC for this class would be cilostazol. Okay, you can use ticlopidine, aspirin, dipyridamole, but again, the question here is what is the best for the patient? So that would be class cilostazol. Okay, I'm not saying you can't use ticlopidine, ha? Pero amongst the options kasi, cilostazol would be the best one. Of course, because the cheapest option would be aspirin. Okay, next question. A 75-year-old patient suffered from transient ischemic attack. Obviously, nagkaroon siya ng mild stroke. And is to be given antiplatelet to prevent it from happening again. After interview, it was found out that the patient has allergies to salicylates. What medication would be best for him? So very good. Clopidogrel class, because clopidogrel would be the drug of choice for patients with allergies to aspirin. Okay. And between ticlopidine and dipyridamole, cheaper ang clopidogrel. To prevent post-op deep vein thrombosis, which of the following anticoagulants should be used? So very good, that would be heparin. Okay. What is the MOA of tranexamic acid? So very good, it inhibits plasminogen activation. It's in tranexamic acid class is the antidote for fibrinolytic drugs like streptokinase, anistaplase, okay, those kinds of drugs. Amongst the direct thrombin inhibitors, which of the following is used for percutaneous interventions only? So very good. That would be vivalirudin. Which GP2B3A inhibitor has direct adhesion property, inhibitory property with anti-inflammatory effects? So very good. That would be abscizumab. Okay, most of you answered this one. And among the heparinoids, which one produces no thrombocytopenia? So good. That's fondaparinux. That's why it's also the most expensive one. Okay, next one. Arrhythmia. So what drug can be used to manage SVT or supraventricular tachycardia? Now, class, we can often use calcium channel blockers. Very good. Pero we don't use second generation ones. Why? As we mentioned a while ago, class, second generations are vasodilators. They are vasoselective. Unlike class with diltiazem and verapamil, which is a first generation CCB, they can manage class. They can reduce the contractility of the heart. Hence, can be used to manage supraventricular tachycardia. Okay, we don't use second gen CCBs. We usually use first generation CCBs to manage supraventricular tachycardia. So again, that's verapamil and diltiazem. Which of the following can cause AV block or atrioventricular block? So that's digoxin. If you remember class, digoxin, let's just erase this one. Diba class, ang digoxin is a positive inotrope, but it's a negative chronotrope. So meaning it reduces heart rate. But it increases force of heart. Yun na lang. Okay, so it can reduce heart rate. How? By causing AV block. That's the reason why class digoxin, okay, though it can be used class for atrial fibrillation, pero it can induce naman AV block. This was the first drug to be used for arrhythmia. So very good, it's quinidine. This drug can treat both atrial and ventricular arrhythmia. So very good, quinidine din yun. This drug increases refractory periods that can lead to torsade de poix. Okay, torsade de poix class is a condition wherein it's a ventricular tachyarrhythmia class wherein ECG readings would look like a party streamer. Mga ganyan siya. Okay, and of course, that's a dangerous situation because it's a ventricular tachycardia. Sorry, a ventricular condition. And that can usually be caused by procainamide. This drug has no effect on action potential duration. So very good, that's flecainide. Okay, so this drug has extended duration of action and is used only for treating ventricular arrhythmias, and that's disopyramide. Quinidine was first used as very good. It was initially used as an antimalarial drug. So hydroxyquinidine, yung mga ganon, antimalarial drugs were derived from quinidine. So they also found out that quinidine pala, aside from being an antimalarial drug, can also be used for arrhythmia. So this drug is used for digitalis-associated arrhythmias. So very good, that's lidocaine. If you're using a digoxin class as an antiarrhythmic drug or for any reason, let's say for example for CHF, and a patient is experiencing arrhythmias induced, like AV block, induced by digoxin, then a good option class to manage that arrhythmia induced by digoxin would be lidocaine. So this drug can be used for arrhythmias induced by stage fright or exercise. So very good. We have the drug propranolol. Okay, so kung if you're afraid of public speaking and you're starting to experience tachyarrhythmias and so on and so forth, propranolol class can be used to manage that. Next one, dyslipidemia. So which of the following is or are risk factors associated with coronary artery disease? Very good. That's smoking. Occasional drinking is very fine. There's no problem with that. Oh, here's ano. This is a condition wherein a group of tissue is completely deprived of oxygen, leading to cell death. Cyanosis class usually it's lack of oxygen. Okay, so you don't die immediately. Pero class, if it's infarction, that's a complete deprivation of oxygen, which leads to ultimately necrosis. Pero class, a condition wherein a tissue is completely deprived of oxygen would be infarction. Ischemia is lacking of oxygen. Okay, kumbaga it's not yet complete deprivation. Which of the following is an effect of all of the following is an effect of atherogenesis except, very good, increased blood flow because it causes a decrease in blood flow. Okay, kasi tawag nyo is except. So, yeah. Bile acid is made up of which of the following? So, very good. It's made from cholesterol. CHO stands for carbon, hydrogen, and oxygen, which is carbohydrates. If you put N here, like chon, carbon, hydrogen, oxygen, and nitrogen, that's a protein. So, CHO, that's carbohydrates. Okay, something you learned class from biochem. This organ is responsible for synthesizing cholesterol. So very good, that's the liver. It's the liver that produces our cholesterol or synthesizes cholesterol. This part of the lipoprotein is responsible for making it water soluble. So very good, that's the phospholipid portion of the lipoprotein. And lipoproteins are recognized by hepatocytes and other cells that utilize fats through its apoproteins. Okay, apoproteins class serves as IDs or markers in your cholesterol, in your lipoproteins, which allows them to be utilized by your cells. Kumbaga ID niya yun, ID yun ng iyong fat. lipoprotein. So this class of hyperlipidemia results from inherited genes. So that's primary. Secondary class would be usually due to lifestyle. Wala naman tayong tertiary causes of hyperlipidemia. So this substance is found in the endoplasmic reticulum and is responsible for the upregulation of LDL receptor genes. So very good. That's the SREBP, okay, which is also a target actually class of HMG-CoA reductase enzymes. HMG-CoA reductase inhibitors or the statin drugs. Okay, they upregulate SREBP. Yung mga statins natin like atorvastatin, simvastatin. So this is the rate-limiting enzyme in the biosynthesis of cholesterol. So very good. That's HMG-CoA reductase. HMG-CoA. Tama, reductase. Which of the following can cause an increase in the upregulation of LPL? So if you want to increase LPL activity class, we use phenofibrates. Okay, or fibric acid derivatives like clofibrate, phenofibrate, so on and so forth. This drug inhibits the oxidation of LDL. So that's probucol. I'm glad majority of you guys know this. And then the mode of this drug is still unknown, but it has been shown to increase HDL levels and decrease LDL levels. And that would be niacin. This drug can cause cutaneous vasodilations leading to redness or pruritus. Again, still niacin. Common side effect associated with niacin. And it is contraindicated for people with gout because it causes hyperuricemia. Again, that's still niacin. So this gland controls the metabolism and rate that glucose is used up in respiration. It's very good. That's the thyroid glands. Okay? Thyroid glands class or the thyroid hormones are well known to manage our metabolism. So sila yung nag-manage yung metabolism natin. So the following hormone can be used to treat prostate cancer. Okay, it's very good. That's the GnRH, gonadotropin-releasing hormone. Okay, which is believed to this hormone can help manage prostate cancer. So this hormone is used to treat hyperprolactinemia. So very good. That's dopamine. Okay, kaya nga you can also use bromocriptine, which is a dopamine agonist. Alright, bromocriptine. Sulat na lang natin. Which is a dopa agonist. This hormone causes water to be reabsorbed. So that's the antidiuretic hormone. Diabetes insipidus involves the increase or decrease of which of the following hormones? That be the antidiuretic hormone. Kaya nga, diabetes insipidus class is different from diabetes mellitus. Diabetes mellitus involves an increase in your sugar levels. While diabetes insipidus naman doesn't involve sugar levels. It involves your antidiuretic hormone, vasopressin. Okay? Or also known as vasopressin. Alright? And that's pretty much the end of our rationalization of our pre-board exams. Okay, so hopefully, class, you learned something. Okay, and you'll be able to apply this not only in your board exams, but also in your practice as a pharmacist soon. Okay, so thank you very much, class, for listening actively to our discussion, to our rationalization. And again, class, good luck to your upcoming board exams. So God bless everyone.